Thank you so much for the invitation. I'm really proud to be here. And I'm going to be speaking about longevity nutrition science as it's applied in ophthalmology. And I also have a $1 million challenge that I think everyone should be taking and will be taking somewhere in his life. I have to say I'm really overwhelmed because it's been a quite amazing trip so far. It's an odd quarter of a century since I first presented in this Congress back in the last century. At that time I was giving a lecture on keratoprosthesis, and this is the first presentation I'm doing as a generalist. And generalist, what I mean is, despite having a quite a successful practice for 25 years, it was a kind of mechanistic practice. If you are really a subspecialty for so long, it's very, very easy to miss and create a major handicap for yourself if you're thinking just like a subspecialist for your life. If you keep diving deeper and deeper into less and less, you get a deceptive picture and appreciation of reality. So this is the book I wrote a few months ago. It's a biased and personal brief summary of contemporary medicine that I totally almost neglected for 25 years in my successful, but as I said, quite mechanistic career so far. It has 4 principles of interest. It's based on the microbiome first. It's a key new player, and it is extending beyond all subspecialties, and especially in ophthalmology, it's got a lot of impact. It's going to have a lot of in the future. Now, nutritional lifestyle, there are protocols that help us in defining preventive strategies against chronic disease and premature aging. And then, of course, it's contemporary longevity research, and we've got things like deep learning, next-generation sequencing, CRISP, and the Yamanaka protocols, and they are really accessible to the average researcher, and that's really very important. Now, in the nutritional and supplement domain, it's really huge, as you see there. So, a few months ago, Dimitras Kontra from the University of Chicago gave an outstanding talk on how the gut microbiome is progressing in the fields of retinal diseases, AMD, ROP. And really now, it's unbelievable how much money is being funneled to this research. I'm not going to speak about the gut microbiome. It's a totally different story with the ocular microbiome. And I think many of us in this room probably realize that there's something amazing, extraordinary, but still elusive in describing the ocular surface of very young humans. And as I do so frequently in my book, I'm going to be using a metaphor in order to describe what I really think that the ocular microbiome is. It's, as you see there, a very new, brand new stadium. It facilitates enough spectators, but they represent just a tiny bit of the microbiota population that resides in humans. The players on the field, on the actual corner, are really very, only a handful and very specific. So if this delicate symbiotic system is disrupted, hell can break loose, as you can imagine. You can get infection, corneal ulceration, or just dry eye disease. And in a sense, we can see that all clinical pathologies can simply be viewed as a surrogate of the microbiota's dysbiosis. And we can see microbiome research getting into keratoconus and tube pathology. And one of my recent inventions after becoming a generalist, along with my dear friend Dimitris Koudalakis, is the no-touch single-soft contact lens insertion system. We strongly believe that by avoiding touching the lens with bare hands, we can protect the user against disruption of the delicate microbiota of the ocular surface. And we hope to prove that by doing controlled experiments with metabolomics. Another idea that is, of course, after becoming a generalist is the idea of introducing the idea of pre, pro, and postbiotic fortification of artificial tear substitutes. And we've got ample of time, of course, to dive into this research deeper. I thank Haralambia Boletti's team in the Hellenic Pasteur Institute for initiating and following through this groundbreaking research. So, another way, I guess, a generalist would tackle eye disease is through longevity research principles. Those are the 9 hallmarks of aging. And it seems that we only have, let's say, a few metabolic pathways that dominate the central stage of medical research at this point. And of course, this has been translated already into the eye. This is the PI3K pathway. It has to do with glucose metabolism in glaucoma and AMD research. And of course, the role of sirtuins in diabetic retinopathy and microvascular disease is well described. The AMPK has to do with uveitis, cataract, diabetes, glaucoma, and retinoblastoma, for example. And the mTOR, guess what? It is a major pathway for glaucomatous damage. So, if you become a medical generalist now, you will not need to barricade yourself behind a slit lamp like I did for 25 years. You will immediately appreciate that most of chronic diseases that we see, they are associated with systematic chronic diseases, and you should all bear in mind what MET-S means. It's metabolic syndrome, and the next is non-alcoholic fatty liver disease, and sarcopenic obesity, and thin on the outside or fat in the inside syndrome of metabolic dysregulation. And you might think that my patients do not have metabolic syndrome, when half of us over 50 actually have some kind of subclinical metabolic syndrome. It is a global epidemic. And if a generalist would see it like this, metabolic syndrome has to do with heart disease, lipid profile, hypertension, and so on, I think a generalist ophthalmologist should see it like this, that glaucoma, also cataract and macular degeneration are associated with dysregulation of those pathways that are common in human disease. So if you believe that you have nothing to do, that glaucoma, cataract, and macular degeneration have nothing to do with this, this is a myth that is busted. So what can we do? How can we offer our patients and ourselves the benefit of a treatment? Well, you don't have to look very far, okay? You've got diet, you've got medical fasting, proper exercise, sleep, stress management, and having a purpose in life. Let alone what is coming with the medical, in the medical field. And if for no other reason, you might feel so amazingly well if you follow through a program like this, that you will just feel amazing, and you will want to tell the whole world. That's exactly what happened in my case, at least. So by regulating sirtuins, mTOR, AMPK, and so on, you can actually get 13 years of healthy lifespan and this is priceless. I think everybody would understand that. And it's not rocket science. I mean, proper nutrition is not rocket science. And it can strongly protect you from chronic disease and can help you with chronic disease in the eyes as well. So what I propose is to know your macronutrients, especially fiber and alcohol, how they relate to your health and your patient's health. It's a good idea to go colorful, plant-based, and I don't mean colorful packaging, of course. This has to be avoided almost in everybody over 50-60. You have to know the basic story of how and why we are here with the low fat and the low carb diets, where they were wrong, where they were right, and how you can combine this into let's say, a protocol that combines the best of each theory. And of course, realize how important time restriction, specific nutrient restriction, and caloric restriction can play in your overall health. Of course, eat for your microbiome. And if you implement all these things, I guess this is a graphic representation of how your health can be. It's an upright tower of health. But what's coming around the corner with a P5 medicine is something like this, because you can actually turn the game around by implementing new rules. This is certainly at this point science fiction. But this is reality. We have people that they are generalists, and they're going to be solving the problems that we face every day as subspecialties, and they have absolutely no idea about the types of glaucoma or whatsoever, because they can implement generalist view in everyday problems that we face. I think we are here, and as physicians, we are both perpetrators and we are the victims of this system. We have to realize that there is nothing better to activate an alter gene expression than lifestyle changes, and not pills and not surgery, because we are providing to our patients and to ourselves just symptomatic treatment. So, what does that mean? 13 years of better life? Well, I see people in this audience. What would that be in our profession if we were to add 13 years in our top, let's say, performing age in ophthalmology? I would reckon that's about at least a couple of millions for each and every one of us. So let's poke the bear. What do I mean? Well, as you have to renew your license at 65, and assuming that surgical dexterity of cataract surgery remains significant, is society ready to accept 80-year-old surgeons? Currently, I know 1 or 2 ophthalmologists. They are pushing into their 80s in Greece, and they are doing excellent phacosurgeries. They are doing open sky lensectomies. What if now 15% of us, let's say the next generation of baby boomers, decides to pursue a purpose in life through ophthalmology like we are accustomed doing right now? Is there going to be a generation rage, as this Yale professor thinks, that older people should commit suicide? Of course, technology will give us insights, because currently, I guess you all understand, you all would agree with me that the person that really knows if you're competent enough to do your surgery, compared with other people, is your scrub nurse, especially if she works in an open access facility. And what is coming along is that in the future we can all have the same scrub nurse, and she's not going to be a human, she's going to be a computer, I guess. You can do your overall performance grading, your efficiency, safety, consistency, energy and consumption, complication rate, dexterity, whatever you like. And after implementing artificial intelligence, I believe that in the hands of generalists, it is expected to perform miracles, like this AI-driven e-donor selection program we are launching for funding right now. So stay tuned, the best is yet to come. Thank you so much for your attention. We will be launching an English version of the book soon, maybe a German and a Turkish one as well. You can get some free preview in the website, and thank you all for your input and your valuable critique. And how I view cross-linking now as a use-stress model in the next presentation that's coming up tomorrow. Thank you so much.